Hey everybody, Dr. Amy here with Fortress Physical Therapy. Today we are going to demonstrate body tempering. What's this big metal thing I'm hanging on to? Well, this is a body tempering spec. It is straight steel, and you can also see some knurling on this. This is 22 pounds. This is a very common modality that I'll utilize on patients in a static position. So you can see I have my patient Whitney here. He's just kind of hanging out. Fantastic demo today. And I love this modality because I love having the patient relaxed, right? Because think throughout the day, we're constantly moving our muscles. This is just another application that we can use as a physical therapist, with the exception of our hands, and give our hands a break to help push out some muscle soreness, to help what we call, or the quote to this is, develop passive strengthening. So as far as the cylindrical contraption, this can range literally from 10 pounds all the way up to like 300 pounds. It was developed by Donnie Thompson, and Donnie Thompson was a heavy weightlifter, power weightlifter champion, and he just developed this concept. So I learned some of these techniques from him. And in fact, I'm not sponsored by Donnie. That would be cool though. But he has some tempering aspects, tempering rods through the Rogue Fitness product line. So not sponsored by Rogue either, but I'm going to demonstrate what I would commonly do, specifically with my heavier roll that I have. So I'm going to show you that. I'm not going to use the 22 pounder, but this is my 50 pounder roll. So you can see it does have some contoured edges on this, and it's also nice because I can grab the end of it. So what I do, I usually start at the buttocks of the patient, and the patient typically just feels a lot of pressure, but good pressure. It's almost like kind of going to a massage therapist per se. So the patient just statically kind of hangs out, and I like this little contoured edge, as you can see, this contoured middle aspect, because when we go up the back, we avoid the spinous processes of the vertebrae, or the pokey parts that come out of the back. So that's another cool thing that I like specifically about this tempering rod. As I roll it up the back and down the back, it's nice to avoid those bony areas. And, I usually do this perhaps maybe for about 10 minutes or so at the end of patient sessions. And it literally feels like you grew like 2 inches. So I'll kind of get in the upper hamstrings where they connect to the booty bones and hit the backside of those hamstrings. I tend to focus on the posterior chain, but you can do this on your front side of your thighs, calf muscles, even your inner thighs or inner quad muscles. So I'll kind of just go up and down to the patient, on their legs. Ooh, might get some sweet spots here, what? Ooh, definitely good for the calves, especially if you do a lot of running, cycling, jump roping, box jumps, even Achilles tendonitis. Oh yeah. So this is nice. This is a nice modality that I like to incorporate with patients, and it feels good. You just feel like a lot of pressure. There might be some pressure points or tender points that a patient may experience, but the pain is a little bit temporary. So think of this as you're flushing out kind of like lactic acid, and you're spreading the blood around into the tissue that is a little bit bothersome for the patient. Again, this is just a fantastic modality, and not only to help save the therapist's hands, but to help build that, what Donnie likes to say, passive strengthening of the muscles, the tendons, the ligaments, the bones, the joints. So, you know, a little bit of tempering TLC, 5 to 10 minutes a day, can make a huge impact on the way that someone moves optimally and functionally.